I'm JB Wogan from Mathematica, host of the podcast On the Evidence, and today we're recording a special episode on video about free interactive online resources to help state contact tracing efforts. My guests are Holly Matulowicz and Shuli Gurovich from Mathematica, and Jill Rosenthal and Eleanor Higgins from the National Academy for State Health Policy, better known by the acronym NASHP, which is a forum of, by, and for state policymakers, helping them learn from one another to innovate and improve state policy. Now, I'm excited to talk about both of the online tools today, but before we actually debut them, I'd love to get a little bit of the background and hear the origin story of how they came together, how you all started to partner with one another.
Sure, and I'll start with the high level and then I'll turn it to Holly for the details. As you all experienced at the beginning of the epidemic, we were receiving a lot of data from multiple sources, and especially the state health policymakers were trying to figure out what was going on in their states and how they can reach to a reliable source of information. So at Mathematica, we started to pull together the resources as well as some information about how you can measure COVID when you look at the claims data, what kind of analysis you could do, things like that. As we were building this, contact tracing became as an important tool for managing pandemic. And immediately, Holly and I started thinking about what information will be helpful for the state policymakers and how we can present this national overview of what's going on in the states real time. And from there, Holly and I discovered NASHP because they were thinking the same way. And we contacted them to see if we can collaborate with them, since at the end of the day, for the public good, we're all collaborating and providing the resources for the people who are on the ground, time to pull that resources themselves. So with that, I will turn to Holly to see the next stage of our origin story, so to speak, and how she worked on the tools.
Yeah, so as Shule mentioned, we were in conversation with leadership at various states, and as they were talking about the need to launch their contact tracing efforts in a robust, systematic way, we realized that they were, in conversation with other states and local areas, learning from each other, having these conversations, all over, and we thought, wait a minute. There's a need here. There's a gap that we can fill. And so what we could do is compile all of this knowledge from publicly available sources in a single place so that each state or local entity that was looking at doing contact tracing could learn from a robust repository of different people, if you will, and their approach to the work, because they all have to determine, how are we going to do staffing? What will that look like? How many people do we need? What kind of background should they have? What do our protocols look like? What are we going to ask people? What kind of technology supports are we going to need? What are the unique needs of our population in our state or local area? So again, the idea was to just put this all these decisions that people had been making in a single place, so that at least they had a starting point from then to follow up on further conversations. So a state that looks like mine, I would look at other states to see their approach and what I could learn from them, and then maybe follow that up with a phone call from there. But taking that initial legwork, really off their plates in a time when time was of the essence. So we really felt like we were filling an important gap with this work, and it's been incredibly rewarding. I'll turn it over to my colleagues at NASHP to tell a little bit more about their origin story.
Thank you, Holly. I would say from NASHP's perspective, as an Academy of State Policymakers, we're always scanning the health policy landscape to identify ways that state officials can learn from each other and develop innovative solutions to challenging health policy issues. So when we started this in May, contact tracing just felt like a natural area to explore and a crucial state tool for curbing COVID-19. So we knew the pandemic would require significant ramping up of contact tracing, both capacity, funding, and that there was a gap in information on state approaches. So our goal was to provide a user-friendly, lay-of-the-land analysis of state approaches to contact tracing so that states could identify options and consider strategies.
Let me ask one quick question about the why behind these two tools, because I think it may surprise some of our listeners, some of our viewers, that there isn't a national contact tracing program or strategy. What leads, or what is the cause of that variation across states and localities in terms of how they're approaching contact tracing today? My impression is there's something to do with the way public health in general works in this country, but anything that you can say in terms of why there's so much variation?
And I can start off, and then this could be kind of a collective answer. What we are seeing is, at the end of the day, the management of the COVID-19 is local, right? Things are happening at the local level, and you really need to know the local context. And with the contact tracing and case investigation, it has to be grounded in the local resources. And it does have that relationship between local at the county and public health official level, state as the secondary, and the federal. The strategies have to be aligned, but it doesn't necessarily need to be managed at the federal level. We think that at the end, given that how local these outbreaks are and the resources, it would require some local infrastructure. I think the other thing that we are seeing in terms of variation is everybody is starting from different places, and contact tracing is not new for the local authorities, public health departments. So everybody started from somewhere. What was challenging was the speed and the scale, right? And how you can go from 1 to 10 in a matter of week was the challenge. And there, I think states took different approaches depending on whether they are at 1 or they are at 5, or how much resources they had to get to that level of 10 when they can manage 1,000 cases a day for contact tracing.
And just to drive this point home, this is it, right? I mean, there isn't another better resource currently out there if you want to know the landscape of contact tracing around the country.
Yes, we have had an overwhelming response to this resource. And I think, to your point, because there is limited information available on how states are approaching this. And so it's been one of NASHB's most viewed resources in the last few months. And we've gotten inquiries from states, from reporters, from vendors, technology vendors, from even the Federal Centers for Disease Control and Prevention has looked to this site to look for information and learn about state approaches and get a sense of the national landscape. So it's been quite popular, and continues to change and evolve. And because of that, it continues to be something that is quite popular with very many, a lot of different audiences.
So if someone does, an internet search on contact tracing in the United States, they might come up with, news articles that might have highlighted, a few states' approaches here or there, but it's not sort of a comprehensive sweep across set dimensions that you can track over time. We're updating this over time. And so that you can follow the story of how states are evolving in their approaches or the decisions that they're making about capacity or technology, et cetera. So it is pretty unique, and also with the rigor that we're approaching the work and the transparency. We cite all of our sources, and so that people can take that deeper dive if they would like to go to the source that we have gleaned the information from, so they can see it for themselves.
Okay, great. Well, we've been talking about the tools. Maybe we should show people what these tools look like. Eleanor, do you want to take the reins?
I would love to. So I'm going to share my screen here and give you a little bit of a walk through the tools. So I'm just going to take a look at the tool here. And I guess I want to point out that when you first get onto the NASHP page, you see this color-coded map. And that is intended to illustrate different state models and that states are taking for this work. So orange indicates an in-house model with public officials leading the contact tracing work or hiring additional employees if needed, and recruiting volunteers. Yellow is states that have formal contracts with a private company, a non-governmental organization, or a nonprofit to do contact tracing work or hiring for that work. And green indicates that the state is partnering with an outside organization. And in those instances, the state is leading the work, but relying on these sort of less formal partnerships with other organizations for training or staffing. And additional information about who the partners actually are in all of these can be found in this tab right below the map tab on the left, which says model. So that shows for each state who the partners might be. The next tab down gets into whether states are taking a centralized or a decentralized approach to contact tracing. And in a centralized approach, the state is leading the contact tracing efforts. And in a decentralized approach, the local health departments or local entities might be leading that work. And a lot of states are using kind of a combined approach there, with state and local entities contributing staff and leadership to the contact tracing work. Moving down, we have the tracing process tab, which is when we get a little bit more into the information about how contact tracing is actually being carried out in the different states. So the info in this tab, it looks at strategies for initial outreach, which individuals are being tracked, what the definition of the state is for a contact, like how are they defining that, and what resources are provided to improve contact tracers' work quality as they do this. And I'd like to point out that in this tab and also the other ones, we have our sources hyperlinked right in there with these green hyperlinks. So if people want more details, they can click on those and they'll take you to the news source or the state website where we got that information. Moving down again, the workforce and training tab, that looks at how states are managing their contact tracing workforce and what training the tracers are receiving. So states have mostly ramped up their workforce through partnerships, direct hiring, or recruiting volunteers. And a lot of those people are new to this work. So the training piece is a really important element of that. Next tab is technology, which is the information that we found around each state's approach to contact tracing tech, because there's lots of mobile applications, mobile phone applications that are being used, social media campaigns, or like online symptom trackers, all kinds of technology is being utilized. And then the last tab is funding allocated by the state. And that's where we identify any information we found about funding or funding sources that the states have earmarked for contact tracing. And then quickly, I do just want to move back up to the map tab here and show you that you can get all of the information from each tab for just one state at a time if you click on that state in the map. So I'll do Illinois as an example. If you click on Illinois, you can see all of that information for each category across the different tabs. And it still has these hyperlinks in there so that you can, from that place on the tool, you can get additional detail.
As Eleanor mentioned, we're pretty systematic in our approach, and we try to be very transparent about the sources where we're getting the data from, as she showed you with the hyperlinks, where people can drill down to see exactly where the information came from. And so, as our team approaches each update, what we do is we think about these categories there on the left, almost like a table, and each state is a row, and we look at what's happening now and what changes may have come about. And our goal ultimately is to sort of put ourselves in the state's shoes and let them tell their story through the publicly available sources. So we'll go to the State Department of Health website. We'll go to governor's announcements, things of that nature, where it's really them telling their own story in a public way. That's our goal. When that's not available, then we would go to news sources that would be telling that story on behalf of press releases or things of that nature. But our goal ultimately is to really help facilitate the state sharing its own story through public channels. So we document that, we document the sources of our information, just really to be the one-stop shop, as we've talked about, across all these dimensions. And we're really pleased that this is a very user-friendly tool that people can see this information, visually at a glance and get some takeaways, as well as drill down into the various details of interest. So recognizing that, when we approach data collection, we do it within context. Who is our population? What are the challenges that they might be facing, et cetera? We felt it would be really helpful to infuse in this the context, the census data for each of these states, large states, small states, densely populated states, less densely populated states. They all have data collection implications. All of these pieces have implications for the approach to your contact tracing. And so we put together this companion website that would really help give people a sense of the context. So if you go down here, and this is hosted on the Mathematica page, but they link together. Here we present, the census data, which is publicly available, and it just gives you a snapshot, of the US overall. And then as you click on each specific state, it gives you a sense of the population as well as some key characteristics that the census data have, again, publicly available about that population, such as age, race, sex, ethnicity, as well as poverty. What percent of their population is persons experiencing poverty? And that's really important as you think about strategies for contact tracing, because people experiencing poverty may have very different experiences with COVID in terms of, risk, and also, the approaches that you may need to take with the data collection. For example, if you're doing only telephone follow-up, what will that mean for people that are experiencing poverty and may not have access to reliable phone service? Who might you miss? So just using this data to set the approach to contact tracing in context, recognizing your risks, recognizing areas where you may need to just be very thoughtful in your approach to the data collection.
With these tools, what I know these aren't, say, traditional research projects. It's not like you're reporting out a final evaluation report, but are there interesting trends, anything that you're seeing as you're tracking contact tracing across states over time?
Yeah, I could provide some comments there. So as I said, we started this in May and we've been regularly updating it since then. And we are seeing that states, their approaches continue to evolve. And the tool has been a really nice way to track trends over time. So we've seen shifts in state models in technology-related supports and community engagement. So for instance, over time, states have shifted from more in-house models to more partnering and contracting models. We've also seen new partnerships forming, especially with colleges and universities. And we've seen states that are launching or piloting new apps. So Eleanor mentioned that in the technology tab when she was sharing the tool. So we're seeing more apps to provide users with exposure notification and using Bluetooth technology. We've also seen states engaging with, and in some cases funding, community groups to reach historically underserved populations and to do things such as improving cultural competency with their contact tracing. So those are some of the trends that we've seen over time.
Well, these tools are both really exciting. What's next for you all? What's next for these tools and for your larger efforts to understand and support state contact tracing efforts?
We have our next update planned for early December, and we're going to keep updating it as long as we continue to see trends and states modifying their approaches. So we will continue to do this in 2021 as long as it provides useful information on state approaches.
And then I'll speak from the research side a little bit. As the states are approaching it differently, I think we are going to see increasing need about effectiveness of these approaches. How many contacts they can reach, what is that return rate, how they can manage the epidemic, and the use of technology. As Jill mentioned, now we are seeing more mobile applications and other tools in our toolbox. So it will be great to look at it again from the national perspective and start understanding which tools are more effective than the others, or which combinations work better compared to the traditional methods.
There's just such benefit, such collective potential benefit in being transparent with each other about our outcomes. In terms that can help inform, redesign or future design or refinements to design. Things like, call outcomes, the percent of contacts, the percent of cases that agree to provide contacts and provide contact information, the percent of cases with viable phone numbers, it all helps inform the planning and the budgeting for the work ahead. And so, as states can be more transparent in their outcomes with these different efforts, it can help us all collectively refine and plan and budget for the work ahead. NPR has done a brief piece on this with some states highlighting some of their work, but there's just a need for so much more. There's so much more we could share. So I think that as states look at this, if they can consider, sharing their outcomes, I think it can help a lot of people with future planning.
And of course, contact tracing is only one part of a necessary strategy for responding to the COVID-19 pandemic. So before I let you all go, is there anything else that you all are working on related to COVID-19, ways to support government and other organizations that are trying to prevent the spread or control the spread of this virus?
Sure. I think on NASHB's side, as I mentioned earlier, we're always scanning the environment for ways that we can help states learn from each other. And so there's many areas of COVID that we're exploring. We have a COVID-19 State Action Center on our website, and we're still working on a whole host of related topics. So we're looking at COVID-19 and implications on racial equity. We're looking at vaccine distribution plans, issues related to housing, telehealth, oral health, many other issues. And so the Action Center is a place that you can go and find information that highlights certain state approaches and also provides more of this kind of environmental scan of state approaches to a variety of a whole bunch of different issues.
Right. There are a lot going on our side as well. One thing that I want to highlight is the after action review. So we are working with the Public Health Institute to create the toolbox. As I said, as the infection rates are going up, it might be worth to look back and how we managed it in the early days to learn so we can improve our programs. We are researchers at Mathematica. We have years of experience looking at the data and creating rapid cycle evaluations. So there is a lot of work going on now, understanding the, how the long-term care, for example, was managed during the first wave, and what we can learn, and creating recommendations for the policymakers.
I would add some of the highlights from this year. There's some interesting work happening with wastewater testing and trying to use that as an early warning system for a rise in COVID infections. We just had an interesting pilot project out of Jackson County, North Carolina. That had some promising findings. And we also had a really cool project out of the state of Pennsylvania that used agent-based modeling to predict the spread of COVID-19 in schools depending on a range of factors, like whether you open full-time or part-time, whether you mandate masks and other precautions, and what the level of community spread is at that moment in your community. So there are definitely, and I expect there would be more things like that coming out in 2021. Well, Shule, Holly, Eleanor, Jill, thank you so much for talking with me today. If people want to learn more, I would imagine they can go to either NASHB's website, that is, let's get that correct, that is nashp.org, or if they want to look at the tool on Mathematica's website, that is mathematica.org.